Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. I am so excited to introduce to you my newly launched electrical appliance online store. It has high quality refrigerators, it has washing machines, microwaves, air fryers. It has ranges too. You can basically be cooking on top and you're baking something on the bottom. It also has these 5-in-1 food processors. Please support the work that I am doing on this platform by purchasing any of these items. Please place your order today by reaching out to me via WhatsApp or via a call on my numbers on the screen, and then your order will be delivered to you. Deliveries can be done to all parts of Uganda, but in the future, as the business grows, I'll be able to ship to those outside of Uganda.
Please place your order now.
I am back to talk about the first healthcare associated infection, that is the central line associated bloodstream infection. A central line associated bloodstream infection is a bloodstream infection that occurs in individuals that have a central line, also known as a central venous catheter, in place or within 48 hours of its removal. A central line, also known as the central venous catheter, is a small flexible tube and it is usually inserted in a large vein within your body, and sometimes it is used for administering drugs, fluids, nutrients, and sometimes we can also use it to draw blood for samples when we want to carry out some tests on the patient. The central venous catheter, also known as the central line, is usually inserted in a big vein within your body. A vein, by the way, is a blood vessel that takes blood from the parts of your body back to the heart. Some of the veins that are employed for this procedure include the femoral vein, which is a vein within your groin region or in your thigh. The other vein is the subclavian vein. It is a vein just below your collarbone.
And the internal jugular vein, that is a vein within your neck.
The central line associated bloodstream infections are usually as a result of microorganisms, germs, called the bacteria and the fungi. The bacteria that are commonly implicated in the central line associated bloodstream infections include Staphylococcus aureus, coagulase negative Staphylococcus, the Enterococcus species, the Streptococcus species, Escherichia coli, and bacteroids. The fungi that are commonly implicated in the central line associated bloodstream infections are the Candida species. The central line associated bloodstream infection usually occurs when bacteria, for example that on the skin, grows in large numbers, and then it starts to grow on the external portion of the central venous catheter, the central line, that portion that is closer to the skin that has not entered into the vein. So the bacteria starts to grow on that portion that is outside the vein, and then it grows towards the portion that has been inserted in the vein. It can also occur as a result of contamination of the central venous catheter, the central line, during its insertion. It can also occur as a result of hematogenous spread, that is, spread of the infection via blood. For example, a patient had infection elsewhere in another system of the body. For example, they had a urinary tract infection, a respiratory tract infection, for example, an infection in their lungs, a pneumonia, and the bacteria could have been transported by blood and it infected the central venous catheter, the central line. It can also occur as a result of contamination of the skin around the central venous catheter, the central line. For example, a central line was inserted and you accidentally touched the area around the central line, the central venous catheter, you can easily introduce bacteria from the surrounding, especially if the bacteria was on your hands and then you accidentally touched that area where the central venous catheter, the central line, was inserted. Especially if the hands that touched the area of the central venous catheter insertion were dirty. In a setting of the central line associated bloodstream infection that is caused by bacteria, the bacteria go through different steps in order to cause infection, to cause the central line associated bloodstream infection. The first step is the reversible attachment. In reversible attachment, the free bacteria will come and attach to the surfaces of the central venous catheter, the central line, but they are not adherent, they are not embedded on the surface. They can easily be removed at that stage. The second stage is the irreversible attachment. During irreversible attachment, the bacteria will start to produce a given chemical called the extracellular polymeric substance. And this substance helps the bacteria to adhere to the surfaces of the central venous catheter, the central line, such that it cannot be removed. This substance is like glue, it is glue-like, so it allows the bacteria to adhere to the surfaces of the central venous catheter, the central line. The extracellular polymeric substance, the glue that is produced by this bacteria, also help the bacteria to withstand harsh environments as well as antibiotics, the medications that are supposed to kill these bacteria. The third stage is formation of microcolonies. During the stage of formation of microcolonies, the bacteria start to grow in large numbers on the surface of the central venous catheter, the central line. The fourth stage is biofilm formation. During this stage of biofilm formation, there is formation of well-organized structures, and these structures are made of groups of bacteria, clusters of bacteria. When the bacteria cluster together in small groups, these are called biofilms. These biofilms facilitate the growth and spread of the bacteria on the surface of the central venous catheter, the central line. This biofilm formation is also responsible for the chronic and persistent infection that is associated with indwelling devices, in our context, the central venous catheter, the central line. That is why if there is infection going on, they have to be removed. For example, the central venous catheter has to be removed because it already has these biofilms. These biofilms continue to be a constant source of infection, a constant source of the bacteria, and the patient will continue to be sick until the device is removed. In our context, the central venous catheter. The fifth step is dispersion. During dispersion, the bacteria detach from these biofilms. The bacteria that has been detached from these biofilms will now start to grow on another portion of the central venous catheter. It will start to grow in large numbers to form the microcolonies. Remember that microcolonies occur as a result of individual bacteria growing in large numbers. The detached bacteria can also be transported into the bloodstream, and this is when it causes the central line associated bloodstream infection. When transported into the bloodstream, it can also cause other complications. For example, suppurative thrombophlebitis, when the bacteria causes infection within the veins, and it will also cause formation of clots within the veins. It can also cause another complication called endocarditis. Endocarditis is the inflammation, irritation of the inner lining of the heart. It can also cause septic arthritis, that is, the bacteria will infect the joints and there will also be formation of pus within the joints. Osteomyelitis, that is bone infection. Abscess formation, that is collection of pus in a given part of the body, as well as sepsis. The risk factors for central line associated bloodstream infection include immunosuppression, that is a low immunity. For example, individuals that have malnutrition, poor feeding, individuals receiving total parenteral nutrition, that is those individuals that require or are receiving nutrients via the veins. For some reason, maybe they cannot feed via the mouth. The very young and the very old, individuals that have undergone bone marrow transplantation, individuals that have had a long hospitalization before the catheter was inserted. For example, they have stayed in the hospital for some long time, after which the central venous catheter is inserted. Extended catheter indwell time, that is if the catheter stays in place for a long period of time. The longer it stays, the higher the chances of getting the central line associated bloodstream infection. Also, if a multi-lumen central venous catheter was used, that is why it is always good to use a single lumen central venous catheter. It is a safer option than the multi-lumen central venous catheter. Also, if there is a breach of the aseptic precautions during the insertion of the central venous catheter, the central line. The signs and symptoms of the central line associated bloodstream infection include fevers, that is an increase in the body temperature, rigors, that is the patient will start shivering. There will also be reddening around the insertion site of the central venous catheter. There will also be pus discharge coming out of the insertion site. There will also be central venous catheter dysfunction, that is the intended role of the central venous catheter insertion will not be realized. For example, the healthcare professionals might fail to use the central venous catheter for administration of fluids, drugs or nutrients because maybe the central venous catheter will just block out of the blue. It will become dysfunctional. It might become blocked because of pus formation or clot formation within the vein. Sometimes the patients that present with a central line associated bloodstream infection might just present with the complications of the central line associated bloodstream infections that I laid out earlier. For example, septic arthritis, suppurative thrombophlebitis, osteomyelitis, abscess formation, and endocarditis. One of these complications might actually be the only thing that the patients might present with. I urge the healthcare providers to be on the lookout for these complications in patients that have the central venous catheter inserted. The investigations that we carry out in the central line associated bloodstream infections include blood cultures. The samples for blood cultures should be obtained before any administration of antibiotics. We usually take off 2 samples. One sample is taken from the central venous catheter and the other is taken from the peripheral vein. The blood cultures help us to ascertain the causative agent, the germ that is causing the central line associated bloodstream infection. And this helps us to tailor our medications towards that germ. We can also do a complete blood count, a CBC. We can also do inflammatory markers, for example, the ESR and CRP, and these usually help us to ascertain the progress of the central line associated bloodstream infection and its response to treatment. When it comes to the treatment of the central line associated bloodstream infection, the following can be employed. We can employ antimicrobial therapy, that is antibiotics or antifungals, depending on the results from the blood culture. The central venous catheter, the central line should also be removed. However, it can be replaced when the blood culture results show that there is no more infection going on in the bloodstream. there is resolution of the central line associated bloodstream infection. But before that, it should be removed, because if it stays in place, it will continue to be a constant supply or a constant source of the bacteria, because remember I told you about the biofilms that are formed on the surface of the central venous catheter. So these continue to be a constant source of the bacteria or fungus. Please also note that the central venous catheter can only be replaced if it is still needed. So if it is no longer needed, there is no need of replacing it. However, if it is to be replaced, it should be replaced on a different site. When it comes to the prevention of the central line associated bloodstream infection, the following can be employed. The healthcare provider that is inserting the central venous catheter should adhere to aseptic precautions. For example, the use of antiseptic agents for skin preparation before insertion of the central venous catheter, the central line. The insertion of the central venous catheter should be done by a healthcare provider that is experienced in the insertion of the central venous catheter. It is also important for the healthcare providers to exercise the risk reduction strategies. For example, on a daily basis, let the healthcare providers look out for the necessity of the central venous catheters. And if there is no need of the central venous catheter anymore, it should be removed. The other risk reduction strategy for the central line associated bloodstream infection is the limitation of the number of the central venous catheters used. It is always important that we use only one central venous catheter, because the more the central venous catheters inserted, the higher the chances of the central line associated bloodstream infection. The other risk reduction strategy is the use of single lumen central venous catheters. Multi-lumen central venous catheters should be avoided because they increase the chances of the central line associated bloodstream infection. The other practice that can prevent the central line associated bloodstream infection is hand hygiene. Hand hygiene is so important because it reduces the amount of microorganisms, germs, on the hands of the healthcare providers as well as the patient and those that care for the patient, for example, the relatives of the patients. So it is very important that each of us in the hospital setting exercises good hand hygiene. When the hands are dirty, they can be a route of transmission of the microorganisms, the germs, to the site where the central venous catheter was inserted. So it doesn't matter whether you are a healthcare provider, the patient, or the relative taking care of the patient. Once you touch the site where the central venous catheter was inserted with the hands that are dirty, you might easily contaminate that site, and then the patient might end up with the central line associated bloodstream infection. In fact, the World Health Organization, WHO, recommends that we exercise hand hygiene before touching the patient, after touching the patient, after touching the surroundings of the patient, for example, the bed sheets of the patient, the property of the patient, after exposure to body fluids, and before any clean or aseptic procedure. WHO recommends hand sanitizers over soap and water. Hand sanitizers, for example, alcohol-based hand sanitizers, except in a few cases, for example, visibly soiled, after contact with body fluids, after toileting the patient, or after exposure to spore-forming bacteria, for example, Clostridioides difficile, or any spore-forming pathogens or germs. Those are the only cases where WHO, World Health Organization, recommends that we use soap and water over hand sanitizers, for example, the alcohol-based hand sanitizers. But in other cases, it is always the alcohol-based hand sanitizers that are recommended. That is what I had for you. Thank you so much for watching and listening. Please share, like, comment, and subscribe. Also hit the notification bell such that you can get notified whenever I upload a video. Please also support the work that I am doing on this platform by purchasing any of my items from my electrical appliance online store. Please place your order today by reaching out to me via WhatsApp or via a call on my numbers on the screen, and then your order will be delivered to you. Deliveries can be done to all parts of Uganda at a free cost. You don't have to pay for the delivery, but in the future I'll be able to ship to those outside of Uganda. Thank you so much, and I'll see you in my next video. Bye.